Good morning, Michelle.
Please remain on the line.
Good morning. Good morning, everyone, and welcome to session 15. Please put your facility name and each attendee in the chat box. We'll get started in just a moment, but I want to be sure that each facility is aware that we're coming up on the end of the program next week. Facilities are receiving credit from the national organization, including some compensation for your attendance. So we have to be sure we have attendance accurate. For the administrators on the call, we will be submitting our, Karen Vleck will be providing you next week with your attendance. The requirement is that 2 staff members from a facility have attended 13 of the 16 sessions. We'll also be providing you with opportunities for makeups. So all this will come next week. We're currently this week in the middle of our Mid-Atlantic the American Medical Directors Association meeting. We're kind of busy with that. So, but next week we'll get to this important area for facilities. So again, in the chat box, please add your facility name and each individual, and we'll get started in just a moment. Don't see Karen Vleck on the call, so let me just quickly text her to remind her to get on and get this attendance. Okay, I'm going to go ahead and get started. Again, welcome to session 15 on well-being. I'm going to start by sharing my screen, and then I will introduce with our slides one of our guest speakers today. Let me get to our PowerPoint. Okay. So our guest speaker today is Christy Weinberger, who is a certified recreational therapist here at Johns Hopkins Bayview Medical Center. And she's going to lead an exercise in well-being as we kick off this important topic today. Jane Marks is also expected to join us. Jane has joined us before as our nurse educator and co-director of our geriatric workforce enhancement program here at Johns Hopkins. So I'm very excited to have both of their participation. So today's learning objectives include identifying ways to address our nursing home staff well-being during this time of COVID pandemic. And we are all celebrating, or I shouldn't say celebrating, we're all acknowledging today 1 year since the official pandemic was identified and noted. And also, and having Victor Boguslavsky joining us from IHI so that we identify ways to use our quality improvement processes to address nursing home staff well-being. So today we're going to start with a polling question, and then we'll be doing a stress reduction activity led by Christy, and then I will review some literature and we'll go from there and then have our group discussion. So let me stop sharing my screen. We're going to start with a polling question, and oops, let me redo this polling question. So our question is, how much stress are you feeling right now? Okay. And the answers are none, slight, moderate, severe, off the scale. So let me launch this, and you can, let me see here. Here we go. So please take a moment and share your opinions of, we've got 32 folks on the call. Christy, so you know, these are administrators, nurses, directors of nursing, quality improvement nurses, and some certified nursing assistants from skilled nursing facilities from the state of Pennsylvania. And they are all part of the Genesis Corporation. You're certainly familiar with Genesis here in our catchment area, and our wonderful transitions to our heritage group. They'll be on our call this afternoon at 2 o'clock. But Christy, just so you know that I'm originally from Pennsylvania, and some of the folks on this call have cared for my own relatives. And so I'm personally grateful to them for the care that they've received. And it's been a real joy for me to be working with them in this Project ECHO. We are in week 15 of 16 weeks of 1-hour sessions on all different topics related to the COVID pandemic. Last week, we talked about resident well-being, and this week it's staff well-being. All right, so I'm going to end the poll. We have 27 of our 33 attendees. And thank you, Kelly Longs, for sharing in the chat box. If I asked the same question this time last year, it would have been completely different. So thank you for sharing that comment in the chat box. So look at this. I would have predicted more stress, but this group, you know, we have that calm Pennsylvania group, right? No. So slight to moderate. Our Tuesday group had a little more severe to off the scale stress. I'm sure that it depends on how much COVID is in your facility, within your family, lots of reasons for each one of us to be stressed. Okay, let me just share these results so everybody can see them. And with that, I'm going to stop sharing the poll. And I am going to mute my microphone. And Christy, you are going to take over for the next 10 minutes.
All right. Well, good morning, everyone. Thank you so much for having me here. And just so you know, I have worked in nursing homes quite a bit, like before. I'm from Minnesota, so I worked in nursing homes in Minnesota. But working at Johns Hopkins for a couple of years now. But so yeah, this past year, I mean, I've been working in healthcare for just over 20 years now. And this past year, I'm sure you can everyone relate, very different than any other time before. So finding ways to cope is crucial, like healthy coping. So today I will be leading you in a guided imagery exercise. And so with this exercise, you are going to take the next few minutes to just take a mental vacation. So today, right now, you're going to go on vacation. So I would encourage you during this exercise to close your eyes. It does help to create the mental picture in your mind. So just allow yourself to have your eyes closed if you're comfortable with that. And as we do this, it's okay if your mind wanders. Just notice that it happened. It's okay, no judgment. Notice it and just try to bring it back to what we're working on today. So we will begin. So go ahead and find a comfortable position in your chair. Rearrange yourself if you need. Just try to get as comfortable as possible with your feet securely on the ground. And now close your eyes and allow your chair to support your body. And first, just notice your breathing. Become aware of the sensation of your breath as you inhale and exhale. Slowly inhale, slowly exhale. And continue to breathe in a slow and relaxed manner. Now imagine a place you find peaceful and calming, and really create the details in your mind. And notice what you see here. Notice if the scene is in color or in black and white. Imagine the time of day. Notice the season. And if possibly there are plants or animals. Maybe there are other people, or maybe you're alone. Just imagine whatever you find most soothing. And if there are other people, imagine the people who bring you peace and comfort. And take a few moments to enjoy everything you see here. Now imagine what you might hear in this place. Perhaps it's quiet, or perhaps there is music or sounds of nature. Create whatever sounds you find most relaxing and take some time to enjoy these sounds, allowing them to bring you peace and comfort. Now imagine what you might smell in this place. Think of the scents that relate to your best memories, the memories that fill you with a sense of ease and contentment. Imagine those scents now. Now imagine anything you might taste in this place. Think of the foods or drinks that help you to relax and give you comfort. Imagine their taste now. Now imagine what you would feel in this place. Perhaps you're floating in the ocean, or soaking in the sunshine, or wrapped in a soft blanket. Create in your mind what you might feel here and allow yourself to enjoy this feeling. Now picture what you'd be doing in this place. Maybe you're resting. Maybe you're more active. Just imagine doing whatever gives you peace and comfort. And give yourself a few moments to enjoy whatever you want to be doing. Take your time exploring this place, allowing yourself to be calm, relaxed, and at peace. And know that this place will be here waiting for you whenever you need a break. Slowly bring your attention back to your room. Notice what you hear in the room, what you smell, taste, and feel. And whenever you're ready, you can open your eyes. All right, so I'm hoping you were able to imagine a place, and if you found that to be calm, relaxing, And if it isn't something you normally do, you can go on YouTube. There's lots of great relaxation exercises like this on YouTube. This is guided imagery. They also have progressive muscle relaxation, breathing exercises, some seated yoga if you even want to take a few minutes on your lunch break. Also, there's a lot of really great apps that you can put on your device, any kind of relaxation app. Several are free, some cost money, but there are several that are free. So thank you. I'm going to give it back to Michelle.
Thank you so much. I know when we did this on Tuesday, I was just so refreshed afterward, and it kept me through the rest of the day. And today I get to do it twice. So
All right.
wonderful. So thank you.
You're welcome.
I'm going to now share my screen to review some of the literature in the topic of well-being for our staff. And let me continue on here. Our session today had video from Sarah Strostrom, a nurse educator in Project ECHO. And rather than show the full 25-minute video, which I do encourage, and the link is here on these slides, I wanted to just put some of the highlights here. And she showed us some of the reasons for stress, our fatigue, our work, and our the fact that we've been working often with low staff numbers at times due to COVID.
Apologies,
also,
everyone. I understand there are some technical difficulties.
I will tell you that right this moment, I am being on a national webinar for the Medical Directors Association, and I'm receiving their PATI Award, a Lifetime Achievement Award. So if you hear it in the background, it's because I wanted to see the presentation. But anyway, let me turn it down, but I'm sure it'll be videoed and I'll see it again. But talk about multitasking and stress, right? But anyway, lots of reasons for all of us to be stressed, but the impacts are known, and we know that quality of care is impacted by the stress of our staff. And in this video, there's some using some of our IHI quality improvement tools, such as this big picture type of approach. We look at some of our reasons for stress early in the pandemic versus more up to date now. And in particular, the loss initially, the loss of safety and security with the PPE shortages and not truly understanding how this virus can be transmitted, and just the unknowns were so stressful for us. The unpredictable safety natures as well, as we had changes in our regulations, certainly came a lot of stress. What we had to do, we've never had to move, even during our flu pandemics or GI bugs, we've never had this type of quarantining and changes in our structure. And then we suffered incredible losses, morbidity and mortality of our residents, but also some of our staff and our families as well. So not only we were dealing with stress at work, we're dealing with stress at home. And at times that lack of social support, this distancing that we've never done before. So we talked last week about touch with Paige Hector in her video presentation for Project ECHO. So we appreciate that at a time when we need more support, emotional support, we have less. And then we have the challenges of the sustainability. Again, today is 1 year. Who would have thought this time last year we'd be where we are now? And so all of these have contributed to our healthcare workers' well-being. This slide comes from how we as humans deal with stress, and particularly these data come, or these type of research come from natural disasters, things like hurricanes and floods, and also man-made disasters. 9/11 was a disaster that was well studied for stress and resilience, and shows sort of this time frame of how we as people react to stress. in times of disaster. And the pandemic is indeed a disaster. And that we initially, as professionals, begin to, our emotions become high, and we go into what we call a heroic phase to say, okay, we need to step up to the plate here. We have a role to play, and we're going to play it. And we go very high in our emotions as we come together to address the pandemic, and we did. But then comes a time when we begin to fall in our emotions because we are exhausted. We've been dealing with it day in and day out. We've had new challenges. We haven't been prepared for those challenges. And we get to then we begin to address these challenges. And here we are now in this phase where the pandemic is beginning to be less. We've got vaccines, we have hope, we have monoclonal antibodies. And now we're beginning to work through our grief and begin to come back to a new norm for all of us. So understanding how we as people respond to disasters helps us get through these stages. Indeed, we are in this pandemic for the long haul. Here's a model, again, using one of our quality improvement approaches with buckets of information for us to digest. So we're looking at readiness and then how we react, readiness with how we go with training and preparedness, how we become physically and mentally and spiritually active. And then how we react, and then our injuries, where we begin to then, with recurrent stresses, begin to have scars, begin to have that loss of control, and can progress to a PTSD type of scenario. I'm certainly seeing that in my COVID recovering vent-dependent patients. I have one right now, I think I mentioned last week, who will be coming off a ventilator in the next few days, but started ventilator support in August of 2020. So you can imagine the PTSD. And he shared with me his nightmares that he's been talking with his wife and our psychologist. And the staff who've been caring for him have been sharing in some of that experience. And I do believe that it's also very healing for our staff to share in that experience. So with that, I'm going to stop sharing my screen, and I'd like to hear from our group today about some of the activities within your facilities. First of all, we'll talk about the amount of stress and staff issues that you've encountered. We'll start with that. Let's acknowledge it and tell us perhaps in the timeline what you've experienced. And then from there, we'll talk about strategies that you've incorporated in your facilities to address staff well-being. So I'm going to mute myself and ask for volunteers to begin. And by the way, my phone is ringing because one of my colleagues from California just saw the video of my award. So I just had to do a quick text to say, thanks, I'll call you later.
I guess I'll go. So we actually experienced the pandemic very early on. Our outbreak actually occurred when the pandemic occurred, and a lot of the unknown was very stressful, and the amount of loss that we experienced was very, very stressful for us. And we experienced a lot of, you're just sitting there doing your job, and then you would just start crying because you felt out of control. And I think that was not being able to feel in control was very hard for us. Our hospice provider actually ended up putting a chaplain here and a nurse and social work support. And the chaplain that we had was beyond the sweetest person I've ever met in my life, and was very supportive. And trying to take any kind of additional tasks that they could manage off of our hands, I think helped with our stress, as well as leaning on each other as team members, and being supportive to one another, I think also assisted with the stress. We try to create a supportive culture here so that one another can lean on each other to help. That pretty sums up my experience.
Absolutely.
Hi, it's Tina. So I agree a lot with what Tara said. However, we experienced our outbreak later than other people. And I think for a lot of us, we felt defeated because we did everything we could to keep it out of the building. And then when it finally got in, I think a lot of us were just very discouraged because we worked so hard keeping it out. I think the other loss that was real for me was having a lot of staff members go out on LOAs for stress, and having staff nurses, longtime nurses, go out for stress, some quitting without any notice. And it took me a very long time not to take that personally, because I felt like I'm in this, my administrator, my nurse educator, we were all struggling trying to keep the building together. And I think it was very hard for us because we felt abandoned by staff that just found it so easy to just leave. So we're still struggling with the after effects. We still have some staff going out on LOA for stress. And the whole time, we've been in it. I mean, for us, I feel like COVID, even though the numbers have gone down, it's never really gone away. And, I'm lucky enough that, we have a very strong management team that has really stuck it out, and everybody has come together, in every way that they need it to, whether it be, the screeners at the front desk, or, just popping in on each other and just checking in, seeing if everybody's okay. Even to the point where I was off on Monday and I came into a nice note hung on my computer just saying, like, hang in there, it's going to be a great Monday. And just little things like that has kind of brought all of us together. But it's really taken a long time for me not to take the abandonment personally, because as the DON of the center, you feel like I need, as many people alongside of me through all of this as we could get. So that's been difficult.
Mhm. Thank you for sharing all of that. And I think many of us feel the same way. I have to tell you, I lost a young doc early in the pandemic who said, I didn't sign up for this. And I was so taken back by that. And actually, I think took it very personally as, well, I'm your mentor, and let me show you the way. And I think it really does make it challenging as a leader to maintain your own stress. Tina, can I ask you some of the strategies that you employed to try and cope with that? Any thoughts there?
I think, at some point, we would just gather at the end of the day and just have our bitch session and just, say what needed to be said. And then, we start over the next day. I remember the very first day we got our first positive, like it was yesterday. And we cried and we vented to each other, but we just picked up right where we left off. And, tomorrow's another day and we're going to get through this. And here we are a year later. COVID is still, with us and pops in when we least expect it. But like you said, we didn't sign up for this, but we showed up for it.
You mentioned your sessions of sharing all the things that have gone wrong. Have you celebrated some of the things that have gone right?
No, not yet.
Fair enough, fair enough. I know here we celebrated yesterday because we gave our first vaccines to inpatients, and this is a chronic hospital, more like an LTAC, but our patients often leave us and go to skilled nursing facilities, and they will now be vaccinated before going to the skilled nursing facility. So the first time we had vaccine to share with them. So we did a little celebration on our unit yesterday because we felt like we had a tool that would help us get through this. So, and we celebrated back in December when we had our staff vaccinations as well. Just having a little more empowerment as well. Who else would like to share your facilities or your personal experiences with staff well-being?
Can I just say, Tina, you saying all of that, like, oh my gosh, you just tore at my heart and kind of summed up every emotion that you go through with COVID and, your first positive and, I thought that was very, very well said. And it kind of just brought this wave of emotion over me and brought me back to all these feelings that, we had at my facility through this pandemic. And, it actually puts me in a better place hearing you say that, because it's like, wow, look at everything we've been through and we're still here, doing what's right by our patients and by the staff. And you should be very proud of yourself as well as the Wayne Center.
Thanks. I have a good team. We have a really good team here.
And I'm going to have you have a wonderful corporate structure that has been engaged in both resident and staff well-being, and certainly in active engagement here in our Project Echo as we're finishing up. So, what facilities haven't we heard from today? Noelle wrote in the chat box, it was hard and still is trying to be happy and also not stressed, plus keeping our team and residents happy and our family members. So I think we're all trying to maintain, and certainly now as family visitations will be opened with all the announcements that came yesterday. Our national meeting is going to have a special section to discuss what's happening nationally because of the announcements from CMS yesterday. So our world is changing again. We hope it is changing for the better, but we have to deal with it.
Hi, good morning. I believe it's still morning. As I reflect on all of the challenges we've had through this past year, when I really think about it, it's a testimony to our strength at the same time. I mean, for those of us, and I've participated, unfortunately, with COVID at, another center at the beginning of the pandemic versus here, and just to see how resilient we are as family, as, our work family, how much we rely on each other for support. We rely on our residents for support, believe it or not. We're not just here to support them, but they support us tremendously. And I honestly don't think I think we complement each other. We pull each other through, and we've done a great job. I think that it's important for us not to forget all the struggles and hardships we've had to go through, and all those miles we had to walk. But understanding we can accomplish when we put ourselves together as a team. There's really nothing we can't accomplish and work through. And I think that's something that we should always remember, and we should continue to communicate to our staff overall. Just that when we put our minds to something, we will be successful, and we'll learn as we grow, and we do it together. So that's what my takeaway from COVID and 2020 has been.
So to summarize your wonderful comments, you're talking about the power of the team. Sometimes we use a buddy system so that an individual will have another individual in their same role, responsibilities to share these challenges with and strategize together, and to both share the stress and share the celebrations that occur. And then you also mentioned some as we learn together, and the importance of collecting data, understanding what's new knowledge, and acting on that new knowledge. And that's what we've been building on in our 15 sessions of Project Echo, is to collect data, analyze data, and respond with action plans. And when individuals have action plans, they're empowered. And some of the fear is replaced with, I've got a role, I've got a mission, and I have an action on how to address it. And I did see another young doctor that I thought I was going to lose, who those types of strategies did in fact work, as we all work together on how do we use our PPE, how do we in fact examine patients who are COVID positive, how do we learn these new medications and new testing that we were doing, a whole new field of medicine for us, and how do we place new orders in our electronic record to manage COVID. But the more we learned, and we learned together, we in fact built a team. And then came some wonderful donor here at Johns Hopkins. We have no idea who it was, but that donor actually distributed through the Hopkins leadership a link for all of us to go online and choose either a windbreaker or a fleece that just had the Hopkins logo on it. And it was basically an acknowledgement of our team. And we've talked about this. We talked about with the vaccines, sharing T-shirts and buttons and things. But it was just a little acknowledgement that, hey, this team is working together to address the pandemic and to address our own fears and stress. And all these, so this came out in January. They all came to our home addresses in the mail in February. I have to tell you what a boost that was. First of all, it was a cold February, right? So I'd come home from work and I would put on my fleece and just feel a little warmth, a little hug, a little Hopkins hug. And that type of what I would call corporate branding and corporate bonding, not just branding, but bonding, gave a little boost to all of us. And now we have spring and sunshine and 77 degrees today in Baltimore. Not sure if Pennsylvania is as warm, but a reason to celebrate. Who else from a facility? I want to make sure everybody has a chance. So I'll stop talking now and make sure all the facilities have or all of our participants have a chance to share your opinion.
I know at Bridgeville, we went through our our bed outbreak in November, and it hit us like really hard, really fast. And so one thing that'll always stick in my mind is we then did our family Zoom calls daily. And actually in November, we were doing them twice a day. Myself and either the CNE and or the CED would get on and do them, and just trying to keep it together for the families and trying not to break down on those calls. Like me and the director of nursing would get on, and I think one time our director of nursing did break down on the call, and it's just hard to keep it together for them. And we're trying to just show them that we're being strong and that we're working hard. And we did break down one time, and it was just that will just always stick with me, just the amount of effort it took just to try and keep it together for the families. But we did get some feedback on that. I mean, we did get a slew of emails, and they actually they said they appreciated seeing the emotion, honestly. Yeah, it was just stressful and a tough time, just trying to keep it together for everybody, for the employees in the center as leadership, and for the families and for the residents. You know, it was a lot.
Jojo, any strategies right now you're thinking about, or as we're having this session, what you might contribute to your facility now for the well-being of your staff?
Just continued support. I mean, we're in a good spot now, thankfully. We have good interim. We don't have that same director of nursing here anymore, but we do have a really, really good interim one right now. And you know, we just try to focus on constantly rounding the building and checking on the staff, and, you know, just seeing if anybody needs anything, you know, seeing if anybody needs to talk, you know, it's just checking on them and being aware of how they're doing, I think is, you know, been helpful, and trying to keep up to see if anybody needs added or extra support.
Jojo, can I push you just a little more to tell me what it is about your new director of nursing that you said she's got the skills you want, essentially? What are those skills? What do you notice?
Honestly, she is an old school nurse. She doesn't take crap from anybody, but she's also very, just very involved and very compassionate towards our family. Like her number one priority is always the well-being of the residents. And she holds the entire staff to those standards in every department. And it's really good to see. She's well organized. She follows through. You know, it's been really good having her here. We wish we could keep her forever, but we can't.
Okay, well, good. Thank you for sharing that. Okay. Anyone else? All right.
I'm
Go ahead.
sorry, just
No, go ahead. Go ahead.
I think, you know, what also assisted in the stress and support of during COVID was feeling supported by our hospital systems and feeling supported by our regulatory agencies. You know, having to manage hospital systems and manage our regulatory departments is stress in itself. So knowing that we had their support and that they were basically in awe of what we were doing kind of minimized, alleviated that stress. And, you know, I was very appreciative of that. And, you know, that gave us more of a confidence boost in what we were doing and being able to manage the situation at hand.
Yeah, Tara, I agree. There's a definite silver lining in this pandemic is that hospital systems and nursing facilities have been partnering because we're sharing our patients and learning together in COVID. So I agree with you there. I also want to say this Project Echo, millions of dollars have gone into these sessions, not our individual session, not to worry, but across the country. The goal was that every nursing home in this country came together with this Project Echo, with a curriculum that the country's experts in COVID, recognizing that COVID expertise was evolving, but saying that's okay if it's evolving. We're going to bring a forum together for these groups to share our knowledge, share our concerns, and then use quality improvement principles as well to make a difference. So I have to say acknowledgement that across the country, our federal government's paying for this, said nursing home care of nursing home residents deserve the best possible care, prevention, and treatment of COVID. And this forum is a way to quickly get this up and running. Hospitals did the same. In July, Johns Hopkins launched the COVID hub for community hospitals, and our infectious disease docs and teams, nurses were working together with community hospital teams on managing COVID in the critical illness setting and hospital setting. But this forum was quickly then rolled out to nursing homes, with a much greater number and much more challenging to get all of us together quickly. But that acknowledgement that we're important and the folks we serve, our residents that we serve are important, to me was very reassuring and somewhat uplifting. So.
I would just like to add to Tara's, the community was very supportive. They would bring us lunch, they would bring us snacks, they would put signs out in front, thanking us for everything we do. So that gave our staff a really, really nice lift.
Yes.
Food always helps.
Food does help, doesn't it?
It does.
I agree, but it gets to that human need. We talked about touch, but it's a basic human need and something that we all enjoy. And isn't it somewhat ironic that COVID took taste and smell away from those with COVID, a basic human experience. But for those returning, it's a renewed pleasure. I'm going to start sharing my screen again. And let me go to the next slide. So in the video for this session, there were some suggestions for frameworks for supporting emotional well-being. And these came from research in managing both human and natural disasters. I'll just say that from prior natural disasters came this 5 essential elements of mass trauma, with some of the issues we already talked about: safety, finding our value and our worth in managing this disaster, trying to maintain our own individual psyche and emotions, having that support of our leadership and support of our colleagues we've touched on. And then I hope I've interjected throughout this call the sense of hope that we will persevere and manage this condition, whatever it is, whether it's a hurricane or a flood, which is a quick disaster, but not always a quick recovery, but a pandemic like ours of a full year, more challenging to find that hope. But I've mentioned vaccine, treatments, and lower community prevalence and opening up to visitation now as a result, and also somewhat opening up for our society and our industries, also giving us some hope. There's actually some research on the pandemic itself, addressing anxiety in healthcare workers. And the bottom line are these 5 very easy, and when we talk about quality improvement and that quick take-home message, Victor, I think of you saying no more than 5. Well, here are the 5 for managing emotional well-being and support of our staff, our healthcare staff. To hear me, we want to be heard. What are our concerns? Protect me, do all that you can to make me safe. Prepare me, and part of protecting me is to prepare me. So I understand what are the risks and what are the facts behind the risks. And you remember how early on we were spraying down every surface and so worried and changing our clothes, and now it's all about respiratory protection. We know how this virus is transmitted, and so our masking and our hand washing, and so that our hands don't go to our face with the virus. We understand more how to prepare me. And then support me, which is what this session has been all about. And you've discussed your ways in your own facilities for that support me, and then also that care for me, and taking that time. And Christy certainly gave us some very easy to do to-dos for that care me. And Christy, feel free to unmute if you want to add anything more to the care me right now, but I know that you have such experience there.
All right, I guess I just joined in. So as a recreation therapist, finding things that we really, really enjoy doing, like really good and healthy things, combining that with relationships, because that's one thing that has really taken a hit. Like for myself, I haven't seen my family in 1 year and 3 months because they're all in Minnesota. But one thing we do as a family is every Saturday at noon, we have a family FaceTime call. So I'm still connecting with them. I'm still seeing them, still waiting to see them in person. but yeah, the vaccine's giving hope. But other things like not being able to go to the gym, you know, I made sure that when that happened, there's a nice big chunk of our hardwood floor that has plenty of room for my yoga mat. And that there's not going to be other stuff there. You know, doing things like that to just make sure that I'm doing things to take care of myself, playing around with new recipes, working on planting a garden, just finding things that it's not just me, but for my family that I live, you know, here, my husband, that we're doing things that are beneficial together, still in relationship, meeting up with a friend tonight to go for a walk. It's such a beautiful day today. So after work, I'm going to go visit a friend, but so scheduling in those things that we truly find enjoyable are ways that we're taking care of ourselves right now. And we need those things. We so badly need those kinds of things. So highly encourage you. And I'm sure you've all found some things that you can do, and anyway, yeah. If you have questions about it, you can ask me.
I think you've shared with us your philosophy and your suggestions for hope and how to care for me.
And coping. I feel like it's just been coping as well. And last night, just being finally warm enough, my small group from my church, we had a backyard, we had a meal together, but out at the fire pit, you know, distance, and several of us were vaccinated by now, which was wonderful too. So
exactly.
yeah.
We know the data now when you're with those who've been vaccinated and you maintain a bit of a social distance. We understand the respiratory transmission of this virus. We're finding creative ways to reconnect. So, you know, we don't eat off of each other's plates anymore, but just like you said, outdoors now that the weather's getting nicer, being able just to see and be physically present, but not 6 feet present, is going to work for us. So thank you.
Well, and another piece of hope is seeing some of our family members be able to be here for their family member again, since we've been able to open up for some visitors and having that support. I can't imagine like being in their situation and like, a whole different thing. So it's great for them.
Yeah, thank you.
Yeah.
I'm going to call on Dr. Victor Bogoslavsky. Now that you're writing, there you go. I just saw you look up and share with us your perspective from the IHI with respect to quality improvement.
Yes, Michelle, thank you. I am writing, actually. I'm taking notes as always, and checking with what we have right now. But before that, I'd like to say my congratulations to you on the award. But also would like to personally thank you for leading us through this curriculum. We're now in the 15th session. So wonderfully, you know, focusing on the content, but also constantly repeating the quality improvement perspective and focus on the quality improvement. I think it's just a wonderful use of the time for us, and I so much enjoyed being part of these conversations and learning from you, taking notes, making suggestions, make some presentations and on tools. But it's all about the not only improvement, but I was just thinking about this with this changed complex situation. It's also about the adaptation and also about creating sort of opportunities for the innovation. As we test the ideas, as we apply them, we measure them, we act on them, we learn from that. With the aim, we are making this better for residents, for staff, for everybody, to make it safe and contribute to the improvement of the outcome. So thank you so much for that. And I just wanted to sort of emphasize the point that you just, no, actually someone said in the chat, should we have that poll a year ago, we would have a different sort of answer. And that's also about the adaptation and about changing sort of environment, adapting to the conditions. So I'm very happy that we're talking about from the improvement perspective on this. We talked about the tools like process mapping. We talked about various types of diagrams that helps us to sort of organize our thinking around how would we address that particular issue, you know, from structural sort of point of view, from change ideas, from strategies. And I think this is about time for us to start testing them, those ideas, testing them, measuring them. Simple measures could be, I've just read an article before we started about the quality improvement report, about staff well-being, and someone checked on the staff, they will be interested in having a space, safe space for them to be able to connect, to stay calm, and be out of the noise and spend about 30-40 minutes, and get distressed. And they made that, they tested, they created a space, and they measured that by staff attendance, by their feedback. I thought that was a good example of how would you apply this as a simple change in the quality improvement ongoing sort of perspective. So I really encourage you to think from this point of view. But also I'd like to actually say that I thought it was a very good document in the folder. You can take a look at the session. The folder, it's a 3-page Word document that called the core practices to consider implementing now, the tip sheet for nursing home support and mental health. And it creates some very useful practical ideas about how you can think about, some of these ideas you already discussed. I'm sure you've already tested some of those ideas, but are very practical ideas. How would you put them into the improvement perspective and then see how that works? Just picking an example of Christy, who said, who did this exercise. It's a beautiful exercise if you can incorporate this into the ongoing practices in the facilities, and then see how can you integrate it, how can you put into the schedule. It probably will be a very, very helpful resource for the staff to support the well-being. For the leaders as well. A couple of good documents also came on the IHI's library, and this is.
I'm going to share those right now, Victor.
Thank you.
And let me get over to. This is the tool. We actually had mentioned this earlier in an earlier session, but the psychological PPE, promoting healthcare, workforce, mental health and well-being, is in our library, and it's a full booklet. Here's the link for it, but just I thought a wonderful resource for leadership to consider. And remember this when we were looking at one-page diagrams of how to engage in quality improvement. This is a good one for mental health and well-being of staff, looking at the individual and what the individual can do, and looking what the team and the leadership of the facility can do. And Christy, you touched on a lot of the individual with creating space and finding that time. I've talked a little bit about gratitude and that silver lining. And we've all talked about the importance of sharing our negative experiences, but then reclaiming them in a sense as we find action plans to address what's negative. And our leadership clearly helping us with defining roles, having protocols, explaining when protocols change, why they've changed, not just how they've changed, but the why can often help us reframe and redirect. And having that peer support and particularly buddy system, because then we can share the most intimate of our issues. And I want to highlight Noelle in the chat box sharing her most intimate challenges with COVID. And thank you for sharing that. I also want to thank you for feeling comfortable sharing that in this space. To me, that's such a success of our program, that we can have individuals whose mics aren't working, but who can type and share that personal experience with COVID. Next week, our last session, but very appropriate topic, effective leadership and communication. And we will need to continue communicating. COVID is not ending today with the 1-year anniversary. And next week, 1 week later, we'll be talking about, I think, the final tool in our toolkit of effective leadership and communication. So with that, I'm going to wish you all a great day. Now I'm going to answer some of my calls and share with my colleagues. It's a wonderful day for me. And I look forward to seeing you all next week. Okay, take care now. Bye-bye.
Thank you. Bye-bye.